Good afternoon and welcome to the second episode of In Conversation with Knights. This afternoon we have Professor Tony Carugno, who has accepted to join our conversation. Thank you, Professor.
This is my pleasure. Thank you for having me.
First question would be, what is the kingdom you identify yourself with, if only one?
Well, if I have to identify with one kingdom, I'm wearing the pin. It's the hysteroscopy kingdom. That's the kingdom that everybody wants to belong to.
So, in your kingdom, question number 2. What is the strongest weapon as a procedure or as a technique for the management of the infertile patient?
Well, the stronger weapon that the hysteroscopy has is that we can actually get inside the uterus. And then once we put our eyes, our hands inside the uterus, we can fix whatever the pathology is.
Thank you. Next question is, in considering the latest recommendations for the workup of the infertile patient, is there any updates or modification that you would fight for, and what is it?
Well, I'll definitely advocate for hysteroscopy before every single IVF cycle. There is evidence that, at least the evidence that we can provide, that we get, as I said, we get inside the uterus and we fix the problem before the embryo gets there. So hysteroscopy before IVF must be a guideline.
Thank you. Next question is, what is your unpopular opinion, if any, among the other knights in the kingdom you belong to?
Oh, the unpopular opinion is that they think that we are mechanics, that we are all we do is surgery. We don't use our head to treat the pathology. They think they're the brain and we are the hands. That is not the case. We are actually the entire package. We think, we visualize the pathology, and then we have our skills in our hands to go fix it.
Perfect. So at the opposite side, what is the most medieval practice that is still ongoing regarding the infertile patient management?
Oh my God, the one that we definitely need to abolish: blind procedures inside the uterine cavity. That is really medieval. That should disappear.
Thank you. For the purpose of the final win, that is reaching the fertility outcome for the patient, what would be the best partner among the other two kingdoms?
Well, that's a difficult question. I would say both kingdoms are equally partner, because the whole goal that we should get out of this meeting is that all kingdoms are the same, are equally important, and most importantly, we are fighting for the same goal: getting our infertile patients pregnant.
Thank you. Last question, a bit provocative on the battlefield. If you could duel with only one knight, who would he or she be?
Oh my God, that's a difficult question to answer. I will fight Stefano Betocchi for sure.
Thank you very much. Thank you. Thank you.
Tony, hysteroscopy against ultrasound. Years of fighting. Then it seems to be a conclusion, and then we have a third actor now, the IVF world against hysteroscopy and ultrasound.
They have no role. What they don't understand and what they envy us is because as we get inside the uterus, they cannot.
Yes, but we don't have to fight. I mean, we have to find a solution, and now seems to be that 2 of the 3 actors, let's say, agreed, I hope, hysteroscopy and ultrasound. But it is now the third actor, the IVF world.
They gonna understand that we're gonna bring them to our kingdom.
One day.
They soon.
Soon.
Very soon.
Yes.
Very soon. The question is, in the meantime, what are we going to do with their gladiators?
Exactly. That's a problem. They write papers where it seems to be that hysteroscopy has no roles. I mean, ultrasound, they cannot say anything against ultrasound. But, there will be the day they will say, even without ultrasound, let's go directly inside the uterus with our products.
The problem is, the evidence that they want is really hard to get. Are we going to randomize 1,000 patients?
But don't you think it's a matter of business?
Good question.